Good morning, good afternoon, and a good evening from wherever you're watching us from. And welcome very much to this webinar that is looking at building bridges in Ghana's healthcare sector. And we'll be taking some time to explore the gaps, the opportunities, and to have a real good conversation around what we could all do together, to rally together, to think through what it is that we can be able to do to begin to heal, to complete some of those gaps. So I welcome you. And as we kick off, we'd love to know where you're watching us from, where you're joining us from. So I would start with myself. My name is Watao Gaita. I am the Chief Strategy Officer for Unique Global, and I am based in Nairobi, Kenya, and I'm very happy to be here. I will be an excellent panel and a keynote speaker, and I will be introducing them as we go along. And I would love to know where you're watching us from. Please let me know. Put it in the chat. We'll be reading out some of your comments, and we are looking forward to a very engaging and interactive discussion. So I can see from the chat we have Kwabena Owusu. He says he's glad to be here, founder of Supra Care. So karibu sana, Kwabena, we are happy to have you. Karibu sana is actually Swahili for you're very welcome. And you'll find that in Kenya, we tend to mix a little bit of Swahili and English. So welcome. And without further ado, I would really love to take this opportunity to introduce our keynote speaker, Dr. Morrison. Dr. Morrison is very well known. He has been in the healthcare sector in Ghana for quite some time. He's a physician with about 30 years of experience in the Ghana healthcare sector. And his experience has spanned both public and private sectors. He currently serves as the national president of the Society of Private Medical and Dental Practitioners, as well as a board member for the National Health Insurance Authority. We are very, very glad to have you, Dr. Morrison, and we welcome you to give us your keynote address as you tell us about your experience, your learnings from the sector based on your the work that you have done and what you envision going forward. So very welcome, Dr. Morrison.
Good morning, everybody. Can you hear me?
Yes, we can. You can go ahead.
Right. Okay. Thank you so much, Wata, for the introduction. And it is a humble duty to be with all of you this
Dr.
morning.
Morrison, sorry to interrupt you. Maybe you can we would like to see you a bit more clearly so that we can see your face.
Can you see my face now?
A little bit better, some more.
Right.
Maybe further back.
Okay.
We can
is it better?
Slightly, but a little bit more as well. Just
okay.
You can only see half of it.
Oh dear. Okay. Yes.
You can lower it just a little. I know these things happen when you're going live, but I'm sure we'll be fine. Okay. We all have had an experience like this at one time or the other.
Right. Right.
I think as they are adjusting, I'm sure you can be sharing with us your experiences.
That's right. I'm trying to. Is it better now?
Not yet. There. I think there. Perfect. That's
it's
perfect.
Better now. Okay.
Yes.
Right.
Yes.
Thank you so much. Okay. So can you hear me?
Yes, we can. Please go ahead.
Okay. So distinguished invited guests and our dear potential investors who are desirous of investing in our dear country's health sector. and then the panelists who are going to also do justice and do a deep dive into our healthcare sector to enable us, all the participants here present, to appreciate what choices we all have. And also to the moderator, I'm indeed grateful for this opportunity. The topic we have for this short webinar, and I'm going to be very brief, has to do with unlocking potential opportunities in Ghana's healthcare sector, the market tour preview. So this is a preview to the market tour that is going to happen in March, and I'm sure the moderator is going to talk about this in more detail. Now, to unlock opportunities, obviously one needs to appreciate and understand what the challenges inherent in the sector are. And so I'm going to start with two narratives that happened just last week. The first one is from a past student of mine who now works in a facility in a district of Ghana. Of course, I've withheld the name. The district is situated along a very busy corridor linking cities and another foreign country. Now, the major problems that they face in their facility is road traffic crashes, which result in serious life-threatening injuries, including head injuries. With a very lean staff at the facility, that is to say doctors, physician assistants, and sadly zero critical care nurses, most of the injured end up being referred. And that is where the problem starts. A call is normally placed to the National Ambulance Service, and this is the first hurdle. The ambulance comes, takes the patient on a number of occasions away because they had called and booked for a facility to be able to handle this case. Sadly, it gets there, and then the chorus is no bed, despite the fact that the call placed earlier received a positive remark. The second narrative happens to be an innocuous question raised by anxious colleagues at a very recent health CPD for our members. And the question is, how come our regulatory agency keeps inundating us with frequent changes in their policies? Distinguished participants, let's break down these two narratives and we'll see exactly what problems are inherent in our health sector. The first narrative, we can outline four main challenges. Now, the first one, because the facility is dealing with accident victims with serious life-threatening injuries, it often is forced to make payment upfront from their own resources to enable a speedy evacuation, sometimes by private ambulance services. And this obviously brings about unexpected rising costs in healthcare service delivery. So one of the first major challenges we have is the rising costs in healthcare service delivery. The next problem obviously brings about financial challenges to the healthcare provider because these are not budgeted for, and therefore it presupposes that the facility is faced with financial issues that are unbudgeted, that are unanticipated. And access to finance becomes the crucial issue for most of these facilities, especially in the private sector. Then, obviously, we can also say from the fact that we said there are zero critical care nurses, the next question or challenge is that there's a shortage of manpower, shortage of healthcare professionals. And probably maybe we're also not doing the right distribution, skewed distribution. As later on you will learn, we have majority of our persons, healthcare professionals situated in most of the capital cities, making access in the outdrawn areas becoming very problematic. Last year, I beg your pardon, GMA did an AGC, and out of that came this forceful issue of burnout syndromes among healthcare workers. They are overstretched, they're overburdened, and they're overloaded, and sometimes with little motivation. So there's a serious burnout syndrome amongst almost all of us. And this obviously brings me to mind the fact that our health, mental health act talks about these challenges, and I think it is important we have an improved mental health system that will support all these clients, including ourselves as healthcare workers. The second narrative brings out a disturbing issue, which becomes a challenge in the terms that if regulatory changes are going to be that frequent, then they impact negatively on healthcare providers. So it means policies must be streamlined, and we need to have all these in perspective. So, distinguished invited guests, another area is our emergency care system. And interestingly, just yesterday, on the floor of the parliament, um, a forceful address was made by one of our colleagues who has just recently joined parliament, talking about pre-hospital emergency care and the emergency care itself. So that is a very huge area. Our road networks sadly are designed, and the design unfortunately contributes to a lot of these accidents. Again, our disease burden is now shifting more into the non-communicable diseases. And this has also made the demand for emergency service very, very critical. Now, all emergency services lend themselves to one critical area as well, and that is increased demand for personalized care. We need the ICUs, the intensive care units, we need our high dependency units, and these are in serious short supply, obviously because of the access to finance that I had earlier on alluded. With these changes with the changes in demographics in Ghana now, there's another interesting aspect. That is the aging population. With aging population, hospice becomes an issue, palliative care becomes an issue, and all this can add to the demand for personalized care. My society, the Society of Private Medical and Dental Practitioners, I speak for the Greater Accra Regional Division, but then I know our national executives are championing the idea of having centers of excellence for specific disease entities. Now, apart from the omnibus hospitals and clinics for multi-care approaches, the need for purposeful infrastructure and centers of excellence for specific disease entities have become paramount. We are passing bills promoting health tourism, etc., etc. And obviously, if we have a good look at having a purposeful infrastructure or centers for specific disease entities, then at least the private sector can also stand tall. And that is how come the mother organization, that is the Society of Private Medical and Dental Practitioners, has taken this bold step that the national is looking at. Now, let me focus on access to healthcare delivery. Let me just talk briefly about geographical access. Having proper road networks to literally expose and communicate with hard to reach facilities is also a serious challenge, and I call that the eighth challenge. Therefore, serious attention must be paid to build the idea of building bridges across supporting sectors of the economy. Health is not only the preserve of the health ministry. There are interlinkages, road network, other areas. So there must be a concerted effort to build bridges across some of these divides so that collectively they can really deliver what they have to deliver. I must emphasize that the term access to health is very broad, and it evokes aspirations in telemedicine, teleconsultations, electronic data capture, digitization, etc., etc. And one needs to take a critical look at these evolving innovations, and I'm sure we'll hear about how to assess these areas through investment. With all these electronic and digitization coming, comes one big challenge, And for me, that challenge is cybersecurity issues and how to handle big data. So obviously, there must be a profound investment into that area as well. So with a plethora of challenges, one may ask, what is government doing to help so that Ghana can position itself as an investment climate for people, investors to also enter? And that is the essence of this whole market tour that we are doing. Now, let me add that the Ghana Investment Promotion Center Act, Act 865 of 2013, and the Public-Private Partnership Act, Act 1039 of 2020, among other policies, we have several other policies and bills that are currently in the making. They all attest to government's preparedness and desire to promote investment in the sector. And I'm sure during the market tour, we'll have the GIPC to delve deep into this particular area. Finally, ladies and gentlemen, a peep into our healthcare delivery and organization will be of importance to all of us. In Ghana, our health delivery system is technically managed in the main by four sectors or subsectors, let me call it. The private sector, we have the private self-financing sector, that is where myself and my colleagues from the SPMDP belong. We have the faith-based, involving all disciplines of religion, etc., etc. And then we have the quasi-governmental sector. These are the sectors we need to work with. However, because government and therefore the public cannot do it alone, there's also an area we have to look at, and that is the ever-increasing coverage of health insurance. Even though we have the National Health Insurance Scheme, we need to, and I'm emphasizing this, we need to encourage and assist the private health insurance sector to grow. This is very, very key for the success of the National Health Insurance Authority, because with a very limited penetration by the private health insurance, we don't stand to gain. And it is important that people would also look at this area because it lends itself also to investment. On that note, I wish all of us a very successful webinar as a prelude to the greater things that are yet to come during the main conference in March 2025. Thank you all very much and stay blessed. Thank you.
Thank you very much, Dr. Isaac Morrison, for that great keynote that has captured and given a very good overview of the current landscape in Ghana, in your healthcare, talking about, the cost of access to healthcare services, talks about the lane burden that we have on human resources, but you've also painted a very good picture around what it is that we could do in Ghana within that sector to grow it, looking at technology, digitization, cybersecurity, and the use of big data. And Abraham Lincoln once said, the best way to predict your future is to create it. So what you've just done is talked about our present, but also painted up a vision for what the future could also be. So we are very grateful for that. And I'm sure we'll come back to you. We'll allow the audience a few minutes after the next speaker to just respond to what it is that you're saying. But we have had you. We have also had the vision. And today we are here to craft a vision and to discuss possibilities. So thank you for that. And next, I also want to introduce the next speaker. And her name is Rahel Musyoki. Rahel Musyoki is the CEO and founder of Unique Global. And she has a lot of experience in healthcare and also having worked within the commercial entities within the healthcare space and a passion for retail. Without further ado, I will invite Rahel to talk to us a little bit as a follow-on to what Dr. Morrison has said. He has laid out the gaps. He's talked about the opportunities as well. How do you see us taking this forward? Over to you, Rahel.
Thank you so much, Watao, and it's such a pleasure to be here. And it's great to see a lot of people who have joined us from around the world. I hope, obviously, from Ghana and from all over the world. So really, really great to be here. And I'm happy that we can have this conversation. And just touching on what Dr. Morrison has shared, access still is a big challenge, not just in Ghana, but in a lot of African countries. So even as we embark on this market tour, which is a pivotal journey for Unique Global and the mission we have to develop the healthcare sector in Africa, I hope that this will be a learning for all of us, not just for Ghanaians, but also for the rest of us in other markets from Kenya, where we are from, and from, other markets globally, because I believe there are significant opportunities and various opportunities for local African organizations, healthcare organizations, and also global organizations to definitely tap into the potential of Ghana's healthcare sector. And obviously, this will be done through the understanding of the innovation outlay, the investment opportunities, and also the potential areas of collaboration. And I know even in one of the sessions that we had with some of the startups and growth organizations in Ghana, they are definitely very significant organizations that have the potential to grow not just in Ghana, but the rest of Africa and also globally, because I believe when we derive solutions or when we build solutions, we don't just build for our primary market, but we look at the whole scope of the healthcare sector locally and globally. So this tour is this market tour that we have put together as Unique Global is not just about exploring opportunities. It is about building bridges between ideas, capital, and solutions that can transform healthcare in Ghana and beyond. So I'm really, really happy to be here. And thank you, Dr. Morrison, for that outlay of the Ghana healthcare landscape. I believe with all the listeners listening in and the ones who will watch later on, they will see some of the areas of potential investment. So, in as much as one of the greatest challenges for healthcare innovators and in the healthcare industry is access to funding, one thing that I should note is healthcare investment has really grown significantly, with over $1.3 billion raised in health tech between 2020 and 2023. And that's such a significant amount, $1.3 billion. And Ghana, which is a rapidly growing healthcare market, obviously stands to benefit from impact investors and also blended financing models that would de-risk investments while ensuring scalability. Because one of the things that we really need to focus on as organizations and even for investment firms is what are we doing? What are the significant milestones or the areas of development that we are thinking about to ensure scalability? Because it will not just work for that small area that you have developed your solution for. It has to scale to other areas as well. So we have to think of investment as a tool for scalability and not just access to funding. It has to be a tool for scalability. And let me just share a case in point of one of Ghanaian's organizations that is really transforming a lot of lives in Ghana, which is Mfama. And I believe Mfama they provide affordable medicines and healthcare solutions, and they successfully or have successfully raised over $65 million from investors, right? Which includes the IFC and CDC group. And I believe this kind of capital can be accessible to a lot of the organizations that are represented here and that are represented in Ghana. And it's because of the blended finance model that supports healthcare innovation. So how do we access, as organizations, how do we access these blended finance models to work for the Ghana startups, for the organizations that are really doing significant things in Ghana? So there are opportunities, and the opportunities are as wide as we will think exist, right? So, and as we think of investments and as we think of all these areas of financing, one of the things that I believe also accelerates scalability is global collaboration or collaboration, which is definitely a key driver of success and as well as scalability and growth in some of the innovations and some of the solutions that we have, not just in Ghana, but for the rest of Africa. And if we can take examples from countries like India, Brazil, South Africa, who have successfully expanded healthcare access through partnerships with international organizations and development agencies. I believe very strongly, and I'm strongly convicted that Ghana and other markets can definitely leverage similar models to attract technology transfer, joint ventures, and also research collaborations, because I believe some of the learning, some of the skills that we have in the different countries that we are in, or the different countries represented here, even on this webinar and even beyond, I believe we have a lot that we can share across that will definitely accelerate this particular objective. And I mean, if I can share just an example briefly, the Ghana Nigeria Health Tech Alliance has definitely demonstrated this power of cross border innovation, and it has facilitated the integration of AI driven diagnostics and telemedicine solutions. So, let's think outside the scope, and let's think of the strategic partners that we can come or we can bring together, or we can bring to the table to have these conversations to accelerate the global health agenda and the universal healthcare agenda that we have in so many countries in Africa. So from, I mean, private equity development finance institutions to public-private partnerships, Ghana must strategically position itself to attract investments. And governments and financial institutions, as Dr. Morrison rightfully put it, must work together to de-risk healthcare investments and create a thriving ecosystem that encourages both local and foreign capital. And that's how this healthcare sector in Ghana will start developing, and it will obviously build up to the level that it needs to build up to, so that a lot more people can access not just healthcare, but affordable healthcare. So, I mean, we know that universal health coverage is a testament to the country's commitment to health financing. So, I believe with this market tour, we will definitely touch on areas that will accelerate this agenda on universal health coverage, so that we can have more investors, more opportunities being put on the table, so that organizations, startups, local and global organizations can take advantage of all these opportunities. And even as we take advantage of the opportunities, and as we get access to all these opportunities, let us not forget that innovation is the gateway to attracting capital. And right now, there's a lot of talk about AI, and people are even scared that they're going to lose their jobs to AI. But I believe AI has come at such a pivotal time where it can actually be part of the innovation culture that we have. And if we embrace AI to help us to accelerate the innovations that we have already built, then I believe the sky is only the limit. So through AI-driven diagnostics, digital health platforms, medical device innovations, all these areas, I believe these are the areas where innovations, solutions can scale and enhance healthcare efficiency and affordability. And I'll just touch on an example briefly on Kenya's Ilara Health, which provides AI-powered diagnostics for clinics. And with the solution that they had, they secured $4.2 million in seed funding. So you can see what the power of AI and innovation can actually do, and how it can attract investments. And obviously, Ilara Health has scaled significantly, not just in Kenya, but in other African markets. So Ghanaian startups, I am challenging you and also other organizations. Please follow this trajectory by building data-driven, tech-enabled healthcare solutions. And that is what will catalyze, obviously, investment opportunities, but also scalability, and more individuals will access healthcare in an affordable way. And we all know that innovation is a currency for now and for the future. So, as I close my remarks, what I know with this healthcare market tour in Ghana, that is from the March 17th to the 21st, definitely Ghana is poised for a healthcare transformation. And this market tour is a catalyst for action. And it is an opportunity to connect investors with game-changing innovations to bridge funding gaps and to unlock the full potential of Ghana's healthcare ecosystem through catalyzing healthcare innovation, strategic partnerships, and collaboration. So let us learn together, let us connect, let us build together, because the future of healthcare in Ghana depends on the steps we take today and in the future. Thank you so much. Back to you, Watao.
Rahel. We hear your passion when you speak about partnerships and collaborations. We know have had a good opportunity to work with you on this journey, and I know you're very passionate about finding strategic alliances that will endeavor to move people forward. And there's a Swahili saying that says, "A boat does not move forward if each person rows on their own." And if you think about this, you can have this depiction in your mind and you're in a boat and everybody is rowing in their own direction. How will that boat move forward? It will be moving sideways and backwards. And what Rahel is talking about here is really the power of collaboration and strategic partnerships. It's understanding what is the issue and how can we all be able to chime in and find a lasting solution. I think Helen Keller is the one who said, alone it, but we can do it when we work together. And that is a challenge. And that is here is the basis of this conversation as we explore the gaps and look at possible solutions. What can we do together? What are those strategic partnerships that we can work on that would be able to move and seal some of these gaps and be able to synergize and harness what we have to begin to, what did Rahel said, innovation is a gateway to attracting capital. So what do we have in our hands and what can we use? So thank you so much for that, Rahel. I want to pause there first and just jump quickly to the chat. We have a few questions that I'll want to take. But before that, let me just give a shout out to Godson Obeng. Thank you for joining. Audrey from the CEO of eHealth Technologies. Thank you very much. Divine, the founder of DAS MedHub. We have Lucy. We have Philippa as well, Kwabena Adu from Farm Covet, Asante Sana. Thank you very much for joining. Edwin from IQVIA. We recognize all of you. We want to thank you for taking your time for joining. So before we move on to the next bit of the webinar, we have some questions from the audience, and I would like to take two questions. Conrad Buckle from UK and Ghana, welcome again to the webinar. So we have two questions that I would like to ask. The first one is, how is the adoption of electronic medical records progressing in Ghana? This is asked by Grace for Obanta Women's Hospital. Please forgive me if I don't pronounce them correctly. I would believe Dr. Isaac Morrison, if you could take this. What is the progression of the EMRs in Ghana as we speak?
Right. Okay. So electronic medical records have become the order of the day. Can you hear me?
Yes, we can. Please go ahead.
Good. And within the space of the National Health Insurance Authority, within Ghana Health Service, almost all the entities that I mentioned about are all involved with medical electronic records, medical electronic records. It is part and parcel of the system. Nobody can progress without getting data electronically captured. It's part and part. It has become a mainstay within the health space of Ghana. The only problem is the multiplicity of various, how shall I say it, systems and softwares. Sometimes you are unable to bridge documents, patients' photo, etc., across the divide of healthcare. And I'm sure work is still in progress to make sure that we all have a unified system. NHI, for example, has adopted that we have now using what we call the Claimit system to handle all the various claim submissions that are made. We also have the Lightwave that we are trying to integrate those two systems. And most of the Lightwave, for example, electronic system is handled within the Ghana Health Service enclave. So yes, there is a concerted effort to make sure that all of us get used to using medical electronic medical records. And so, to answer the question just straightforward, yes, it is part and parcel of our system, and nobody can go away from outside that scope. Yes, but it needs improvement, and obviously, yes, we can, as we bring in consultations, we bring in all the innovations. There's a need to really get one simplified, shall I say, system, if possible, where everybody can seamlessly match and flow onto it, so that patients can be transferred across the divide without any hitches. Yes. I don't know whether I've answered the question. I think that is the question, right?
Yes, that's correct. I believe you've answered that question. That was asked by Grace. And I think her follow-on question was, is it advisable for hospitals to move from manual documentation to electronic? Grace, I hope that question has been answered by what Dr. Morrison has said. I hope you're okay. I can't see any other question for now. But I also want to recognize Jackie Mama Ajua from the School of Bionatural Medicine in London. Thank you also for joining our webinar. For those who joined late, a bit later as we had started, we just want to spend some time looking at the Ghana healthcare sector. We want to talk about the current situation. We're also looking to explore what are those opportunities that are out there that we can begin to explore. We know that there's a lot of innovations that are going on in Ghana and outside of Ghana. And what we want to do, and especially because this is primarily targeted around the market tour in Ghana later on in March, we want to explore what is that landscape and begin to ask our questions. What are the possibilities that are there as we speak? And then look at also what are the other innovations that have been done in other countries, that could perhaps be brought into Ghana to help seal some of those gaps. And at the same time, explore what are the innovations in Ghana that are looking to scale beyond what they're doing and are looking for investments that they can also become a solution to some of those gaps. So today, we're not looking at gaps, but we're looking at the opportunities to seal those gaps. So thank you once again for joining. Dr. Isaac Morrison, Ms. Rahel Musyoki, we are grateful for your remarks. And indeed, we endeavor to find those partnerships and to begin to create the future that we want today, even as we think about what it is that it looks like in the weeks and the months to come. Without further ado, we want to move on to the next part of this webinar. And what we want to be able to do is move on to a panel. We have a panel set up. We have three Ghanaians who understand the ecosystem, who have been in the system, are in the system, and would want to give them an opportunity to share about their experiences, their learnings, where they're seeing the opportunities, and what they believe we can do. So allow me to, I will introduce two ladies and a gentleman. Our first panel speaker is Nancy Ampa. Nancy is an accomplished and visionary leader. She's had more than 20 years of experience in the insurance industry, with 12 of those years in C-suite positions. So she's had the opportunity to work through, to understand the dynamics and be able to see where healthcare is at, especially looking at access to finance, looking at the insurance. She was actually, in her last job, she was the former CEO in the Ghanaian, in the National Medical Insurance. It's called the National Mutual Healthcare, where she transformed the company into one of the leaders in healthcare financing. Nancy has a wealth of experience and would like to hear from her, even as she introduces herself and tells us a little bit about her experience. And then we'll ask her one or two questions around her experience. So Nancy, please, if you could come on and just talk to us a little bit about your experience and what are some of the healthcare financial models in Ghana.
Thank you, Linda. Not Linda Watao, right? I hope you
Correct.
can all hear me.
Yes, we can.
Okay, I think Wata has already done a brilliant introduction. She's hyped me so much. There's nothing much more to say, except I've worked in the health insurance space, both public and private, for the almost 2 decades. In terms of the healthcare financing models in Ghana, I think we've gone through a checkered history, starting from free to out-of-pocket payments, and we finally decided that health insurance was the way to go to attain UHC, hopefully by 2030. So currently, we still have the same mix in Ghana. We have the national health insurance, which is more of a social insurance, and it's covering up to about, I think, 54% of the population. But unfortunately, just about 40% is from the informal sector. So we have more from the formal sector than the informal sector in there. Then we have the, which is very minute. It's less than 2% of the population. It's a very small space. And as Dr. Morrison intimated, it is really not growing due to several reasons. So that over the years, it's been just around the same population for the private health insurance space. So that is another good place to, possibly invest. And of course, unfortunately and regrettably, we still have a lot of out of pocket payments. And that seems to be the mainstay because it looks like almost everywhere you go, you've got to pay out of pocket. So those are the models we have. Of course, they have a few government and donor funded programs that also takes care of certain conditions as we roll along. But like we are saying, increasingly, it's becoming more important, especially to grow the private health insurance space so that we can take that burden of government, so that those who can pay, then government can focus on being a social, having that social impact with the social health insurance. So in a nutshell, that's what I say about the funding models in Ghana for now.
Thank you, Nancy, and thank you for continuing to share with us the picture as it is. Indeed, right there, what you've talked about is an opportunity to also grow the private health sector insurance. I think you said 2%, if I'm not wrong, of the population are utilizing that. So if I'm not wrong,
Yeah,
then that,
it might
yeah,
even be less than 2% actually. Yeah.
right. Okay. So that in itself is a gap, but also a major opportunity for us to begin to explore what it is that we could do to be able to address that and to begin to seal that gap. So when we speak about that, Nancy, I think I have a follow-on question. And the question is, when you talk about those gaps and highlight them, do you have in mind some reforms that are needed to strengthen healthcare financing in Ghana? What are some of those reforms based on your experience in that sector that are required?
I think just like Dr. Morrison said, it's not just health is not just the preserve of the Ministry of Health or it's just healthcare and we see just health in isolation. It has to be multifaceted because again, it's okay to say, okay, I have a health insurance solution for you to cover this, but then I go into the space or the no health care facilities for you to go to with your health insurance card, then of course the purpose is defeated, right? So, and if the facility is there and the road to the facility is bad, then how are we going to get there? If we get the facilities there, there's no staff, there's no staffing and all that. So it's not simply a reform that would help the health sector. It's like it has to be an all-round thing because we need to make sure the healthcare facilities are there. They have the right equipment. We have the personnel to work there, and then you can bring in the insurance solution. That is the financing aspect of it. So it's difficult to take one in isolation and propose reforms for that. So it looks like it's an all-round thing that we need to do. But beyond that, the dynamic more in the informal sector than in the formal sector. So a lot of technology is required to want to reach them. How to reach them? Assuming we put in all the reforms and have all the facilities available, how do we reach them? How do we get them to finance their own healthcare? The issue of affordability comes up rather strongly because if you don't have the right products for the right people, then it becomes difficult despite whatever reforms you to go. So we need to find a way get to the informal sector of Ghana, right? They are the ones who need it, and they're the ones who should be able to afford it. We have a lot of low income people. How do we find products for them to be able to do that? So a lot of things have to come in together to make these things work. And a lot of, despite what you might think, we need a lot of to reach these people to get them to access the healthcare. And again, say the road is bad. You don't have to travel on a very bad road just to go and deal with a malaria or something. This can be done through e-health. So those are some of the things that have to come in. So as for government to provide, Dr. Moise was talking about the frequent changes in policies. We need to be a bit more focused on getting the right. And once the policies are in place and they are stable, then industry, based on those policies, move out and do what is required to be done.
Great.
But I'm done.
Thank you. Thank you very much, Nancy, for that insight. And based on what you've just said, about the need for digital health technologies to enable access and also ensure that, in fact, these facilities already exist for people to make use of them, I'd want to jump on to our next panel speaker, George Kese. George Kese is a CEO of Advanced Pharma. He's got a lot of experience, both within insurance, but also his passion is for healthcare technologies that are addressing the last mile. So, George, I would like to ask you the question: what role do you see digital health technologies playing in the innovation space within the Ghana healthcare sector, and how can they be able to mitigate some of the gaps that we're talking about?
Thank you, Watao, and thank you to the co-panelists. Thank you to our audience. We are grateful for you joining us to share and learn a bit about the healthcare space in Ghana. So I heard Dr. Morrison and Auntie Nancy enumerate quite a few challenges with respect to access to financing, and I think that's where I would want to start from. It's very key to access to healthcare in Ghana, because majority of healthcare in Ghana is funded from out of pocket. So that puts a lot of stress on where is the money coming from and how accessible does it make all the other services available to the average Ghanaian. Because healthcare, even though it's a right, it is not free. So somebody has to pay for it. And that's where the gap is in Ghana, majorly. And that's where technology, I feel, can play a very, very pivotal role in giving people access to healthcare that they deserve. One of the key areas we talked about is challenges we talked about was geographical access. I think Nancy mentioned that. This is a bridge and a low-lying fruit that technology can easily provide, because you don't need to physically be at the facility to have access to healthcare. So these areas are areas that if we focus on as IT enthusiasts or problem solvers, entrepreneurs, and we develop solutions that provide that last mile access, especially on the financial side, because there are a lot of fintech companies in Ghana, but none of them has any niche product for access to healthcare. And that is an area of innovation that is lying wide open and waiting for people to tap into. So these are areas that if developers or entrepreneurs can look into, providing solutions that give access to financial means of paying for your health. And these are products that can be modeled because of technology. Currently, without certain systems in place, it will be difficult to roll out certain products. I think if you speak to the insurance people, they will tell you one of the key challenges they have in giving retail insurance is because of the management and the systems to have it managed properly, because it's a lot different than corporate insurance. So I see one of the guests asking private health systems for people, individuals. But you need to have technology in place to be able to implement such systems efficiently and at a cost-effective pace. So these are opportunities that I feel are low-lying for our entrepreneurs to take advantage of.
Thank you. Thank you. I like how you're building up, George, from Nancy, who's talking about the challenges, And she's talking about innovations, and you're also giving an example of what technology can actually be able to do to ease that gap in enabling access. And I would like to jump from you, and I want to move over to Linda. Dr. Linda Decker, welcome very much to the call. Uh, Dr. Linda is the CEO and founding physician of Franklin Medical Services. She's also the president-elect of the West African Private Healthcare Federation, that's FOAPS, and the immediate past vice president for Healthcare Federation of Ghana. Dr. Linda has worked in the private healthcare sector for quite some time in Ghana. She's very passionate about excellence and accessibility. So, coming over to you, Dr. Linda, based on your experience that you've had over time, especially having worked in both in the private sector, but I know you do have some experience also in the private to some extent. Where do you see private sector contributing to strengthening access to healthcare in Ghana? What have you done in the past? Where are you seeing the gaps? And what do you see for the future?
Thank you, Watal, for having me. And thank you, co-panelists, Rachel, Nancy, George, Dr. Morrison. It's been quite interesting sitting back and listening to your contributions. And thank you for your question, Watal. Looking at the private sector and healthcare, I think that they are I must give a bit of a background to what I perceive the private sector looks like within the ecosystem of healthcare in Ghana and in the sub-region. The private sector serves as a partner to support governments to achieve universal healthcare. In the sub-region, I don't know whether, I think that it came up a little bit when Nancy was speaking, possibly. Private sector provides about 50% of services to the population, both in Ghana and in the sub-region. And our approach to strengthening the healthcare ecosystem lies very simply, I think, in maybe 3 areas. We should look at resourcing, and I think George spoke a little bit about that. We should look at training, we should look at digitization, all within the healthcare value chain. I think the conversation has been, as clinicians, we tend to look at service provision. But when you look at the healthcare value chain, we should look at, yes, indeed, service providers, but healthcare organizations. I think Nancy spoke from the insurance point of view. Pharmaceuticals, the pharmaceutical industry is quite a huge part of the healthcare value chain. Manufacturers, wholesalers, everyone that is involved in the healthcare delivery system is part of that value chain. So when we look at resourcing, I think that we should look at probably direct investment from a clinician's point of view in hospitals, clinics, as well as equipping these facilities. Now, it may seem old school, but I think Ghana is still at the stage where we need to look at that. And of course, the other area of resourcing that George brought up is into innovative technologies, which probably would come up a bit later. So we should look at innovative investments. So should we really look at, especially within the public hospitals owning equipment, or looking at ways in which we can work together as private sector with public sector to provide services that would improve, possibly if we look at dialysis as a service, is it possible to, and I'm moving into partnership here, where we could look at private sector supporting government services with dialysis, and then the government buys dialysis treatments from the private provider. When we look at training, we need to support the healthcare workforce. Even as digitalization, AI grows, somebody has to sit at the back end and support these AI or IT programs. So in training, we should look at technical training, both for health workers. We should look at service and patient-centered training that would improve care. And also, we should look at biomedical training engineers who can maintain these equipments. The third thing that I wanted to talk about was digitization, which George had spoken about, and technology is the only way we can improve workflows. I think EMR has already been discussed at length during the question time. But digitalization would improve decision-making and improve the way our systems work. So I think in a nutshell, I think that this is how we can look at improving healthcare infrastructure. Thank you.
Excellent. Thank you so much, Dr. Linda. Well, and I like what you said, innovative investments. That's something that stayed with me, because we're not talking about regular investment, we're talking about what is that thing that is quite innovative, that we can look at it as an investment that would then further strengthen the healthcare ecosystem. That said, I would want to jump back to George and maybe explore a little bit more to what Dr. Linda has said. We keep talking about technology and innovations. You are very passionate about last mile technologies and how they're addressing those gaps. So maybe you can share with us a little bit from your experience, maybe even a good practice that you've seen, some last mile innovations. It could even be within insurance and supply chain that are already in place or are cooking, because we are here talking about what's coming up, innovations that are looking at addressing some of those gaps that we have outlined. Sorry, George, we cannot hear you.
Hi, can you hear me now?
Yes, now. Please go ahead.
Great. Thank you, Watal. So I believe Africa is in a unique position because we are just on the cusp of getting our basics right in terms of the fundamentals of digital technology and its impact on healthcare. So we have the unique opportunity to learn a lot from the advanced communities and the things that we should not be doing or we should be doing, especially in the field of AI. Because we are now on the building blocks of developing our database for application of in-house AI. Most of the AI technology is adopted based on what has been developed out there. So in building the blocks of data that we collect, we should be intentional about what we intend to do going forward in the next 30 years, especially its impact on our health. So let me give you, for example, we are expecting about 4 million Africans to be dying of NCDs every year going forward for the next 10, 15, 20 years. And NCDs are mostly managed with medicines. So that means, on average, from the age of 40 years till they die, they're going to be on medicines. All these 4 million and over people are going to be on medicines every year. What infrastructure is in place to manage these people on their medications and the after effects and the clinical care that it demands? What technology infrastructure are we building across our healthcare space to manage this incoming epidemic? So that should be the thinking going forward in the way we innovate and adopt technology in solving some of these issues. Otherwise, we are going to be having ad hoc solutions that don't really work. So an example is the EMR systems, as a typical example. As Dr. Morrison said, there's a proliferation of EMRs in Ghana. At least every hospital clinic has one. But how effective is it in changing the way they provide healthcare? Digitalized, assumingly, it has not had any impact on services and provisions that are supposed to be provided because there's no coherence in the way we adopt some of these technologies. So I think we should step back and start looking at how we scale, especially our solutions that we adopt, and the issue of partnership, as Dr. Linda said, is very critical because healthcare is a system, and systems are made up of different parts. So it's essential in any healthcare development, especially on the technology side. There should be a lot of room for cooperation and partnerships with all other stakeholders that impact the service you are providing. Otherwise, your solution is going to be a silo solution that's not going to have any impact going forward.
Excellent. Thank you. Thank you, George, for chiming in. I am hearing a lot of great ideas and opportunities that we could further explore. And someone once said, none of us is as smart as all of us. So sometimes we sit in our corner and we think we have the greatest idea, but it's until we all sit in a room like this with everybody, chiming in and sharing the ideas that we realize we are certainly better together and stronger with a lot more better ideas when we are all putting our hearts on the table. So that said, I've seen questions for you, Nancy. There's a lot of questions around health sector, the insurance. And I just want to read one of the questions. I think this is from Grace Armstrong. And the question is, how affordable are private health insurance plans for the average Ghanaians? Are there flexible payment models available? Over to you, Nancy.
Okay. Private health insurance plans currently, as they are more geared towards the corporate sector. So in that case, I would say for individuals, they are not that affordable. Because of the structure, and it looks like we are kind of stuck with some particular fixed plans and benefits. I must say the industry is lacking in innovation, because you could actually twist and turn the benefits in different ways to make it affordable to people. We should be able to go into individuals and, like George said, we need the technology to be able to reach individuals, how to get to them, how to, get the payments from them and all those things. But somehow we are stuck in the corporate sector because, well, it's the low-hanging fruit. That's what I would say. But it should be possible to come up with different affordable plans for different pockets, for different parts of society. I mean, if you have a standard plan where there's maternity, there's this, there's that, what happens to that single young man who doesn't need maternity? And you've priced maternity and all that into it. He really doesn't need it. Or the older person who, again, does not need maternity, but I come back and say, oh, my plan has maternity in it. So we need innovation in moving those benefits around. Then they can become a bit more affordable, because you should be able to mix and match such that people will be able to get what they want. Currently, there's been little forays into the informal sector. And yes, there are flexible methods of payment. There are as much as even daily payments. Fortunately, we're able to use the recurrent payments in the mobile money industry. We're able to plug into that. So it becomes possible. People are able to pay on a monthly basis through their, what's the name of the thing? Controller and something. Controller and Accountants General Department, those who take their salaries from government. You're able to go there. There are even times you're able to plug into the finance system of a various companies and you're able to take the monies from them monthly. So that makes it affordable. But I still think our premiums are a bit, well, compared to the Western side, it looks like low. But for the average Ghanaians, they're a bit on the high side. And this is, again, because the cost of care is not regulated. When you take the national health insurance, they have a tariff system. So you're able to control cost in that side. But when it comes to the private sector, it's the provider's market. So they determine the prices, change it anytime they want and all that. So that we need a bit of control, there's a bit of regulation there. Then you can have even more affordable. Because once you are sure about your cost of care, then you're able to, design benefits that would work for the different sectors of the public, as it were. So yes, personally, I think that the healthcare cost in Ghana is a bit on the high side. If we're able to regulate the cost, it will become a bit more affordable, and then we can using technology. We can then make forays into the informal space, and then we'll be able to come up with different plans to suit different people. But for now, I think it's on the high side, and yes, there are flexible ways of collecting it for now. For now, yeah, but I don't think they are that affordable. That's my personal opinion. And I'm seeing how is technology being leveraged to improve private health
Yeah.
insurance, such as telemedicine, digital claims, and all that. We started from paper claims. Now we are mostly in electronic claims. At least up to about 90% of all the claims we get is electronic. There are a few that would never, give us electronic claims. So on that side, I think we've done quite well. Unfortunately, some hospitals have to enter the claims into their own EMR and then come and enter it into the health insurance system as well, because half the EMRs are just bought off the shelf, right? Or we get a couple of people from nowhere come to sell you something, and then once you get the health insurance system or application, it becomes extremely difficult to integrate. You want an API and they can't even find something from somewhere, and you actually have to go through a lot of hoops. And I'm not talking small hospitals. In some big hospitals, you have to go through a lot of hoops to be able to integrate those two things. So, in as much as yes, we are willing to go electronic and digital, integration is the major problem here, because people are buying different things from different places, and they don't even have the capacity to do those integrations. So it's difficult to develop APIs to be able to work with those things. When it comes to telemedicine and all those other things, unfortunately, we still don't have a clear-cut policy or anything on telemedicine, right? So you are not. I think Dr. Merson would explain that better, because when it comes to telemedicine, if I'm consulting with a doctor in China, which law is going to apply? I didn't come to your office. Is there something about responsibilities and liabilities and all that? It's a bit technical and legal. So the legal basis for some of these things are not there. So it makes it difficult for you to be able to know how to reimburse it. So that's when I think the policies and the reforms will need to come into play. Once there are definite policies on some of these things, then we know exactly what we do, and then we are guided by, exactly how these things should turn out. So yes, there's a lot of e-health and all that, but I don't think we have a clear-cut policy on it from the government direction on how to manage some of these things. So once that is done, that should be fine. The reimbursement landscape question. I said, what is the reimbursement landscape for private health insurance, and what factors affect, especially the reimbursement of innovative health technologies? Again, the technologies are moving faster than the private health insurance companies, right? So we see telemedicine, we see so many different things, e-health and all that, and we don't know how to handle it. So there's a bit of lack of education on the insurance side. We need to move away from the traditional insurance and traditional healthcare delivery. That's a paradigm shift the company has to take. And then it's only once we agree that this is something we are going to pay for. If we decide, okay, we want telemedicine to be part of what we are doing, if we decide telemedicine is a benefit, we have to define the benefits. And once we define the benefits to include those innovative things, then you can think of how to reimburse for it. But until you do that, it becomes difficult, because then there's always back and forth. Who went, who didn't go, how to prove that telemedicine happened, how to prove it didn't happen, because there are no, guidelines governing it. And for some funny reason, we believe because it's telemedicine, it should be cheaper. I don't know whether that's the case, George. But I mean, from the doctor's perspective, it's still his own whatever. What he's going to school, his skills, his expertise. Should it be different because he didn't do it in a brick and mortar building? Should you reimburse differently for that? Those are some of the things we need to, think around and then come up with policies on. And again, looking at 2% as against the whole government thing, some of the policy direction must come from government, of course, with input from the private sector, and then we can then craft something out and do it. So for now, some of the things are hard to reimburse because we don't know. We are not even sure how do you prove that telemedicine happened? You get where I'm coming from? And it's not always the complex type. It could just be a phone call. It could be SMS. It could be anything. How sure are we? So sometimes it becomes difficult to reimburse for those things. But I think increasingly, most of the companies are reinvesting for telemedicine, a few other new things. So it all depends on how it shapes up. Again, there might be an opportunity there to get structures in place for that.
Great.
I hope
Thank
I've
you.
answered all the questions to a
You've
large extent.
You have answered quite a bit, and I'm sure others will come up. We'll come back to you, Nancy, but thank you for reading through them. I want to first do a shout out to Dr. Linda. You have somebody who's quite happy with, with your services. She says, "You're my favorite doctor in Accra, and I always recommend you." So congratulations again for that. And when we are still on you, there's a question there from George. And George says the human capital shortage and related burnout, even the lack of entrepreneurial mindset is critical. So, what opportunities exist for physicians and other healthcare graduates to innovate solutions in the domains they have identified in Ghana? And why do many rely on government to hire them when there seems to be enough problems that need solving? And I'm asking this to you because you're in the private sector. You've been able to start your own practice, and you can also see what innovations you have implemented. So please, if you could just shed some light there and encourage the graduates who are coming out.
I'll put my up. Thank you for that question, George. I think that by way of background, and I'll come to my personal story, by 2100, almost half the world's youth will be living in Africa. Now, we need to try and figure out how or what we're going to do with this huge number of young people. And economic stability is linked to this. And so we must harness this resource and develop talent. And I think within the healthcare ecosystem, we need to have internships. We need to have creative ways of bringing youth into the workforce, and our workforce would be the healthcare value chain. When you don't have opportunities, you create those opportunities for yourself. And with my personal story, 30 years ago, when I finished medical school, I had an idea of what excellence should look like. I worked within the public sector for a few years. And even within that sector, I saw a need to be a little bit better than okay, to be able to meet the patient's needs. Now, as time went on, I thought there's only so much change I can bring into this space. What can I do as an individual to make a difference? And that's how my journey in the private sector started. I didn't jump up right away and say, my goodness, I'm moving out of the public sector to go and create my own little nest. But I did work within the private sector to try and understand what is it about this that I think could be better, and how can I bring change in my own little way. And so that was my journey. It's been a difficult journey, challenging, but very fulfilling, as Dr. Morrison would also be able to tell you. So I don't know if this is enough information, but we do need to look beyond the government. The government cannot be an employer to everyone. I think it's a little bit unrealistic. And there's a lot of room within the private space to have physicians and other medical people within the medical ecosystem joining. And so I would say that, what is your passion? What sort of difference do you want to make? And probably take that step today and see, how you can impact the healthcare space. Thank you. I hope I answered your question. Thank you.
And thank you very much, Linda. And before I jump to Dr. Morrison, I want to jump to George, because George, you have been interacting with entrepreneurs and innovators. I'm not sure whether they are all, doctors, graduates, but would also like to hear from you, just in response to what Dr. Linda has said. Where do you see the opportunities for these graduates to then, instead of going in, for your traditional being employed by the government, are there opportunities for them to then set out and begin to think about the problems they're addressing and begin to innovate and solve those problems within the space that you are sitting in currently?
Thank you, Watao, and thank you, Dr. Linda, for that fantastic answer. I think basically, in the case of healthcare, it's quite a unique area because because it's so regulated, it requires certain skills and expertise. And there's always some regulation and policy around the work. So, in order to be able to craft solutions for healthcare, you need to understand the work that is being provided. So most often, healthcare workers are encouraged to be entrepreneurs within their workspace because you are the one who understands the work better than others, and you understand the policies that should guide your work better. You understand the tools that will help make your work easier and better for you. So usually, we are the ones supposed to encourage to be entrepreneurs within our own space to create solutions for our own challenges. But unfortunately, to be able to create solutions, you must also understand the problem. And that is where we fall short a bit. To understand the problem, you need to work under somebody, you need to be trained, you need to go through a certain process. You need to get to a point where you fully understand the problem enough to be able to provide a solution. As Dr. Lina said, she strived for excellence. So she had to go through a certain mill to understand why there's no excellence before she can even provide answers to that. So that is the portion where I feel most of the healthcare workers fail to get to, because they always see the problems as challenges. But you need to build your skill set, not necessarily in healthcare, in other areas, to be able to provide solutions to the challenges you see around you in order to see them as opportunities instead of just challenges. And that's where you can start being a solution provider and an entrepreneur.
Excellent. Thank you, George. Seeing challenges as opportunities and becoming a solution provider. Indeed, that is a discussion we're having today. We're looking at the challenges, but looking at them as opportunities and an area for us to synergize. And remember what we said in the beginning, to create the future today in terms of what it is that we want to predict for tomorrow. Dr. Morrison, I have a few questions for you here. One of the questions we have is, what are the biggest challenges that investors face when they're entering the Ghanaian healthcare market? And I think as a follow-on to that, what risk mitigation strategies should investors consider when they're coming into the Ghana healthcare sector?
Okay, thank you very much. The first one has to do with, you talked about the risk mitigation for investors. Yes, our act, I talked about the GIPC Act. I did 5-6. Now, sections, starting from section 27, 28, 32, they give copious advice as regards how you should transfer whatever investment into the country. Once you follow those guidelines, your investment is safe. That is number one. Number two, investors are also obviously worried about transferring profits and returns. The Act specifically gives you that guidance. In fact, once you go through registering with GIPC, making sure the quantum and the value of your investment is known within the country through the proper channels as enshrined in the Act that I've talked about, you are covered. The problem comes where you use unauthorized avenues to invest, let me put it that, quote and unquote. Then obviously when it comes to repatriation, it becomes problematic. In fact, it becomes an illegal affair. So yes, there is that aspect that will safeguard the, your investment and your returns. To the third point, you can invest as an individual in the country. The value of investment then goes high, up to about 2 million, 3 million US dollars. You can also invest in partnership. You can invest in trade. So there are various areas and the guidelines for each of them. You come into the technology space, you come into the fintech space, there's several guidelines. And I'm sure we should have had a GIPC here. They would have elaborated extensively on these sections of the act that I've just talked about. But suffice it to say that once you come in through the proper channel with a proper investment portfolio, definitely your investment is safeguarded. So that is what I can say on that first question. The other question had to do with I beg your pardon. I wasn't able to pick that other question. There was a second question that you posed.
Yes, the second question is, what risk mitigation strategies should investors consider in Ghana's healthcare sector?
I think that is probably the one that I've just rather talked about. You go through the proper channel. But there was a first question I
The
probably
challenges.
the
What
challenge.
challenges do you face when entering the market? Yeah.
Yes, the challenge you face is first make sure you have the right field or sector that you want to enter. Get the right players within that sector to develop the program or the project or the portfolio together with you. Understand that sector. Of course, we are talking about health, so perhaps I can limit myself to health. You want to go into, say, the public sector, you must address and avert your mind to the PPP Act, which I also talked about earlier on, because that will be a public-private partnership. You want to enter into the private sector. It becomes a private-private partnership. That, again, there are a few aspects of that act that gives opportunity to that. But our procurement laws, etc., would also facilitate all the areas that may become a little bit problematic for you. That notwithstanding, in the healthcare sector, it is a must that once you enter, you must of necessity, if it is a healthcare delivery, you must of necessity have a Ghanaian partnership there. And most people want to circumvent that. I've been a victim before. Most people, if you go to the HIFRA Act, Act 829, I think Section 5 or so stipulates that there must be a Ghanaian counterpart. When you circumvent that and you now want to get back your returns, it becomes problematic. So these are some of the safeguards. But at least once you go through these channels, I don't think you need to fear. You need to fear. Ghana is safe haven now, so far as investment is concerned. And I don't think once you do the proper thing, you have any challenges. Thank you.
Great. Thank you. Thank you for that. And I think I've had you emphasize, getting the right players, ensuring that you adhere to the PPP, and then really ensuring that you have the right Ghanaian partners if you're going to come in. And I would want to ask Rahel, are there other risks or flags that potential investors also need to be able to look at, or even for entrepreneurs who are looking for investments? What are those key things that they need to have top of mind as they look for those opportunities for investments?
Yeah, that's a great question. Can you hear me?
Yes.
Okay. So, one thing that I will say, especially for healthcare startups, accessing investment is more than just funding, right? And right now there's such a focus on Africa, and I've shared this before in different forums where money has become, or that bowl of money that is being presented has become, the attractive point, and we do not focus on building the solution to be sustainable or to be credible in the market. So one thing that I will share around investment and what investors look for is the credibility of that particular innovation. Do you have traction? Do you have traction with that solution? Have you launched it successfully in the market? Does it have individuals or people or consumers who are already utilizing it, even if it's to a smaller extent, but at least you're showcasing impact? And also, are you demonstrating long-term sustainability? And what this would require is obviously a strong business model and governance structure, right, as an organization. Number two, how do you partner strategically with industry leaders, with healthcare insurance companies, for example, if that's your target, let's say, organization? How do you strategically partner with organizations that can actually enable you to scale your solution beyond what you have already done with the minimum, what is it called? Minimum viable, what is that? The first element where you have your solution in the idea stage.
An
So
MVP.
how have you actually, yes, minimum viable proposition, or have you actually developed that solution to a point where you have proven the concept and then now it is ready to scale in the market that you're in, the primary market, and after that to other markets as well, right? And then the third thing is scalability and adaptability to address, the local challenges in the current market that you're in, but also global health challenges. And global health does not mean it has to be all over the world. It can be even in Africa, because as I mentioned earlier, majority of African countries have similar challenges in terms of their healthcare issues. So how do you create that solution to be adaptable to address those challenges? So those are the three areas that I would say organizations need to think about. Yeah.
Thank you. Thank you very much, Rahel and Dr. Morrison, for addressing. And I know those were some of the key things that people want to be able to hear as we talk about the gaps and the opportunities. Obviously, the next question is, what do we have in our hands? What are those innovations that are already in market or that are already being tested that are looking to get investors and to be scaled? It's been such an engaging discussion. We've had so many questions that unfortunately not be able to ask all of them. Gloria, Maxwell, Kojo, Kwabena, Divine, I think I've seen some questions and comments that we will not be able to respond because it's two and we want to respect your time. But if we do have your emails, we're also committing to responding to some of these questions via email. Please continue to engage with us on LinkedIn via email as well. We promise to respond to all the questions that we have here. And before we wrap up, and just allow me to give a snippet, just 2 minutes, to give a snippet of the Ghana healthcare market tour looks like. So this is an initiative of Unique Global Consultancy Group, as we had said earlier, based in Nairobi. And what we want to do is take a week in Ghana where we bring in innovators or business entrepreneurs from other countries. We bring in investors and also get investors and innovators and entrepreneurs from Ghana, bring in the stakeholders, strategic partners who are both within government and private sector, and have real conversations around what's the lay of the land, what are those gaps, where do we see the opportunities, and where can we harness our synergies to actually begin to do something, to craft our future for what would want the Ghana healthcare landscape to look like. And that's what we are planning to do between the 17th to the 21st of March. We will have very intimate in-classroom sessions where we are learning from each other, validating our solutions. If you come up with if you have an innovative idea or a solution, would want to come and hear about it, we validate that and then be able to say, how would this work in Ghana? Can this actually be scaled in Kenya or in Uganda? So we are taking the opportunity to share feedback with one another, to look at how we can adapt some of these solutions. At the same time, we also want to go out and do some in-market sessions where we actually see how are some of these solutions working in the market? What are some of those challenges that even the users are having with them, or what are the areas of improvement, or how can we further contextualize and adapt the solution that we have to that market? So we'll do it both in class, but also in the market. And we believe that this very rich mix of learning by sharing and also learning by observation and asking questions will enable us to leave this market tour having one, validated what our solutions are and how scalable and bankable they are. At the same time, what are the areas of improvement, and what are those partnerships that we can then begin to create and leverage as we look to grow and to expand. We obviously would also want to have investors there who, for opportunities for entrepreneurs who are looking to actually get investors into their businesses. So we're also looking to have that very full, well-rounded conversation. So we do invite you on the week of the 7th to the 21st to join us. We'll be sharing further information. I think there's quite a bit that has gone out through our partners, Nancy, Dr. Isaac, George, Linda. If you have any questions, they know a lot about the tour and they'll be more than happy to give you more information. I would also encourage us to please like us on LinkedIn, Unique Global, and follow us as well, because we'll also be posting quite a bit of information there. Without further ado, also allow me to say a deep, heartfelt gratitude to all of you from Ghana to London to Kenya, Nairobi, the US. Dr. Nancy is signing in the middle of the night. Thank you so much for doing that. We are so grateful for your time as participants. We are grateful, Dr. Morrison, for your time as our speaker with your wealth of experience. Linda, with your experience in private sector. Nancy, you're traveling, but you're here. You've a lot of experience in insurance. George, all the work that you're doing in the last mile. So grateful for you being here. And to Rahel, again, thank you for your insights on partnerships. Allow me to finish by quoting something that Dr. Martin Luther King said. If you cannot fly, you run. If you cannot run, you walk. If you cannot walk, you crawl. Whatever you do, do not stop moving. And this is just to say that maybe when you look at the gaps, they look so overwhelming and so huge. But I know that we all have the ability to begin to craft solutions and to be able to think about what we could do to make these things move forward. So if you can run, run. But if you can't walk, crawl. But let's all work together and be able to see where we can harness opportunities. So coming together is the beginning. Keeping together is progress. Making it work is success. So without any further ado, thank you, everyone. And have a good rest of your day and evening, depending on where you're logged in. We'll keep talking on LinkedIn. And from me, Watao, your moderator, it's been a pleasure and an honor. Asante sana.